Dr. Richard Ellenbogen. I'm coming to you from my office on Sunset Boulevard in Beverly Hills, and I want to discuss facelift surgery a little bit with you. Everybody knows somebody who's had a bad facelift. And there are many reasons why facelifts by other doctors do look bad. There are basically three problems as you age. Number one, the skin sags. Number two, you lose the volume in your face. And number three, there is a falling of the internal structures and the muscles in the face, which tend to show on the skin. Consequently, all three of these elements have to be repaired. Most doctors do certainly tighten the skin, many do tighten the muscles, but the real important part is to replace the fat that has been lost, that has been dissolved as you do get old. This takes a very artistic touch. This is something that I've been doing for approximately 30 years. This is probably the reason why my facelifts look so much more natural and never look pulled. Many doctors who do not use face in their facelift surgery tend to have to pull a little further to get rid of some of the defects in the face. Whereas with replacing both the sagging and the filling, the loss of fat, the pull is not as tight to get the same result. The great question people ask me is, how long does fat last? What I've done over the past 30 years in doing many thousands of fat grafting patients and seeing them year after year, very few patients do I have to redo. There are some certain tricks to this. The fat grafting has to be done in the operating room as an operating room procedure. The purification of the fat is a very tricky process, and we take only the finest parcels of fat, the smallest parcel of fat, to be injected into the face to make sure that it does last. But overall, the most important thing is the balance of the tightening of the skin, the tightening of the muscles, and the placement of the fat back in the previous areas. There's rarely a person I can't make 5 or more years younger looking from the facelift type of operation that I do. Also, it's very important that the whole face balance. Some people who have their facelift, which is basically repairing the jawline and the neck as well as the face, have bags under their eyes. You know, just having this done and having bags under the eyes doesn't match. Or having crepiness in the upper eyelids. So in other words, the establishment of youth in the face is sort of like putting together an outfit. The blouse has to match the dress, has to match the shoes. The facelift has to match the eyes, has to match the forehead, has to match the side of the face. The worst is pulling too tight. The second is not utilizing the fat grafting correctly. And the third is not knowing how to tighten the muscles so that the result is not as good as it should be. Doctors make many excuses when they don't have a good result on a facelift. I wanted to be conservative. I didn't want to make you look too pulled or too done. That's basically a doctor who really doesn't know how to do a facelift to get a youthful look. We do operate conservatively, certainly, but we don't try to underdo things and not get the ultimate result that we can get on somebody. What I've learned over the years in perfecting my facelift technique, I rarely need a bandage after the first day. I don't require bed rest after the first day. In fact, I insist part of the treatment is being outside, moving your neck, eating normally, and getting your endorphins flowing. I actually let many patients get on the treadmill by the 5th day at 3 miles an hour. Also very important to our facelift is a careful checking of the post-operative course, making sure that healing takes place in a predictable fashion. The patient, once they're operated on, are basically ours for life, making sure that their desires are something that I did satisfy, because a good artistic result is not as successful as the patient accepts that result and understands that result. So it's a course of myself and my trained staff of getting someone through the surgery painlessly, complication-free, and quickly, so that they can appreciate the result that we get on our facelifts, which are probably the state of the art as it's done today in the world.